Good evening, and thank you for joining us. Christy's in for Karen, who is on assignment.
Today, for the first time in the United States since 2015, someone has died from measles. That report came from the state health department today. An unvaccinated school-aged child died at a Lubbock hospital from complications related to the disease.
Karen McKay attended the news conference at Covenant Children's late this afternoon, along with the reporters representing the national media. Let's go to Karen. She's outside Covenant Children's with the very latest. Karen?
Yes, Abner and Christy, it is a sad day today because it's something nobody wanted to hear, that the first child has died from measles in the whole country in the last 10 years. This case we don't know much about. They're not saying a lot except that it was a school-aged child, as you mentioned. So we don't know whether the child actually lived in Lubbock or maybe in Gaines County in Seminole, which is where the outbreak began on the 14th of February, nearly 2 weeks ago. So we don't know much about the situation. But what they talked about today was how serious this illness is. It's not just a bunch of red spots and a childhood disease with fever and a cough and so on. They're saying people need to realize now this proves that measles can be deadly.
Measles is one of the most infectious agents that we know.
Measles is a deadly virus, as we just talked about. So measles can be very dangerous. The predominant issues that we talk about, and certainly that have led patients to be admitted to the hospital, are those respiratory issues. And so that is a frequent cause of death. There are also neurologic issues that can happen acutely, encephalitis, swelling of the brain, blindness, other issues along that line that can also be a part of acute measles.
That was Dr. Lauren Johnson, a pediatrician here at Covenant Children's, who was talking. She was alongside Dr. Amy Thompson, who is CEO and also a pediatrician at Covenant Children's. And they stressed how important it is for parents not to neglect child care. They're really worried that the similarity here with COVID will be that people will not want to take their kids in because they're afraid they might get measles. If your child is sick with any kind of a runny nose, cough, fever, those sort of flu-like symptoms, they need to be checked by a doctor. And they're saying here, if you'll go to Covenant Children's and go to the little green shed behind the hospital, that's where they're screening children so they can make sure that no children that don't have measles are exposed to someone who does have measles. So that's where you need to go to be checked. It's very safe. They wanted people to know that once in the hospital, if you're there for other reasons, it is very safe. They have the kids with measles in isolated rooms that are pressurized with negative pressure so that no air from inside their rooms go out into the hall or in the hospital. So it's very safe if you have to come to the hospital, but be sure to be screened at the green shed on the north side of the hospital. One more thing that I want to mention, there are 124 cases here now in this area. 3% will die. That's a state number. 3% of the number of cases typically die. We're already at one child. And when I asked Dr. Thompson, she says, yes, there likely will be more. Abner, Chrissy.
Karen, we hear that the vaccine is 2 shots. Are people protected with just having one?
I could hear parts of that. I think you said the vaccine has, yes, I think if you said the vaccine is a 2-dose vaccine, you're correct. And some people have wondered, so what happens now if I only have time to get one? One is better than nothing at all, is what they're telling us. One vaccine gives you 93% effectiveness against the measles. If you get both, it's 97%. So one is good. Get what you can. You need to be protected. If you're not protected against measles, one is better than nothing.
All right. Thank you, Karen.
Back to you.